Good morning. Welcome to Active Aging with Barb. My name is Barb Eisenberg. I'm a physical therapist assistant and also a licensed massage therapist. I work with the team at Therapy at Home, where our passion is to inspire seniors like you to live happier, healthier lives so that you can age successfully and independently with a positive attitude. Together, we can create possibilities as we get older and better. So this is February, almost through with February, but it's American Heart Month. So all this month I've been talking about cardiovascular health and some of the diseases that you can have with your cardiovascular system. Today I'm going to talk about high blood pressure, otherwise known as hypertension. And we'll talk for about 5 minutes about the symptoms, the risk factors, and prevention. We always want to be proactive and prevent these things before we get them. Then we'll get into our exercise program, about 25 minutes of a cardio workout. That means we're going to be moving large muscle groups in a rhythmic way to strengthen our heart and improve our overall health and well-being. So that's the plan. So this information today is for educational purposes only. It's not meant to diagnose a specific condition. So if you have questions about your own body, make sure you check with your healthcare provider or your own doctor. They know you best. So why are we learning about hypertension? Number one, there are no warning signs or symptoms usually for this disease. There's no symptoms or signs that you have it. And about half of American adults have it. About 45% of American adults have high blood pressure. Very big problem. And of those that are diagnosed, only 1 in 4 actually have it under control. So really important to get it under control. Why? Well, high blood pressure can lead to a lot of other health issues because that extra pressure in your blood vessels, you have blood vessels that supply blood to all of your internal organs, your muscles. So it can affect a lot of different systems in your body. And it can lead to things like greater risk of stroke, greater risk for heart attack, for trouble with memory, thinking, learning, because it's affecting blood vessels in your brain. Can lead to dementia, vision loss. We have blood vessels in our eyes as well. So it can lead to vision loss, heart failure because your heart may have to work harder, and kidney disease. So all of these things can be prevented if we keep our blood pressure under control or prevent high blood pressure from ever happening to us. So how do we prevent it? We look at the risk factors. We'll look at those in a minute, but just in case you didn't know, what is blood pressure? There are 2 numbers when you get your blood pressure measured, and you need to do this regularly, otherwise there's no way to know if you have high blood pressure. So 2 numbers. There's a higher number, that's the systolic blood pressure, and that's the pressure in your blood vessels when the heart is squeezing. So the heart contracts, it pushes the blood out throughout your body, that oxygenated blood, and then it relaxes. When the heart relaxes, that's the lower number. That's the diastolic blood pressure. So 2 numbers. Normal blood pressure is 120/80, or 120 to 129 is the normal range. And then if it starts increasing, stage 1 they call it, is from 130 to 139 for that systolic number. Stage 2 is 140 or higher. So you don't want to get anything over 130. That's gets into the high blood pressure range. So what can you do? You look at all the risk factors and you eliminate as many as possible. And you also get your blood pressure checked regularly. So number 1, risk factor, smoking. If you do smoke, keep trying, do whatever you can. Lozenges, gum, patches, medication from your doctor if you really need it. Do whatever you can to quit smoking. It really affects every system in your body. Number 2, diabetes. Prevention or treatment if you are diagnosed with diabetes. A lot of that can be done with a healthy diet and exercise, sometimes medication. Number 3, lack of physical activity is a big risk factor for high blood pressure. I'm so glad you're joining us. We're going to get moving in a minute. lack of physical activity, try to do some kind of physical activity every single day. Simplest thing is just to go for a walk. And here, our spring is just around the corner, so our weather is getting more cooperative and we can get outside and get some walking in. Number 4, poor sleep. Science is recognizing how important, more and more important, sleep is for our overall health. So make sure you can get good sleep. It's important to have a cool, quiet room, no electronic devices. Lots of tips online about how to have good sleep hygiene. A regular routine before you go to bed is really good. Very important to have good sleep. Number 5, stress is a big risk factor. So learn how to control your stress. We're all going to have stresses in our life. We just have to learn how to manage them and how to alleviate them by doing some relaxation maybe. Exercise is a great way to alleviate stress. Getting out in nature. You find what works for you to release that tension and stress in your body. Number 6, alcohol. Drink little, very little or no alcohol at all. The number for men is about 2 drinks a day. For women, 1 drink a day. Alcohol is another thing like smoking. It can affect all parts of your body. Number 7, healthy diet is really important. A poor diet can really lead to problems with high blood pressure. And number 8, which goes along with 7, is a low sodium and normal levels of potassium. So those 2 minerals are really important for good heart health. You need the proper amount of potassium and low sodium. So think about all of those risk factors and manage as many of those things as possible. Just so you know, our next video is going to be talking about nutrition because March is Nutrition Month, National Nutrition Month. So we get to talk about food, one of my favorite topics. So we're going to get moving in just a minute. Just remember, if you have not been exercising regularly, make sure you check with your doctor to get the okay before you start any kind of new exercise program. And if we're starting to exercise and you start to feel any kind of symptoms like shortness of breath, chest pains, dizziness, or lightheadedness, make sure you stop immediately and get checked as soon as possible. So thanks for joining us. Let's get moving with our cardio workout. And we always start with a warm-up. And I'm going to just start by swaying side to side, a little bit different, but big muscle groups. So I'm using my legs and I'm using my arms. Big swings with the arms. Side to side and around. Side to side and around. Side to side and around. Good job. So we're pumping the legs, using those quad muscles. And the big arm swings are using the shoulder muscles. Big motions in a rhythmic way. That's what they call a cardio workout. So it gets your heart rate going, increases your heart rate, increases your breathing, the depth, and also the number of breaths. So swinging the arms, big swings. Big swings and bending the knees. These big quad muscles are strong, one of the strongest, largest muscles in your body, and they help pump that blood around. All right, now we're going to go side to side. So big muscle groups again. Stepping side to side. Good job. Anytime you're stepping side to side, you're using the hip abductors. That's these side hip muscles, the side glutes. And they are very important with balance. Balance is something that some people think just naturally gets worse as we get older, and it really is something we can work on. It's not inevitable that your balance is going to get worse and worse. If you keep working at it, your balance is going to be great as we get older. So we have to keep at it. And these side-to-side motions strengthen those hip abductors. One of those is the glute medius. And that's a really important one for balance. So side to side motions, great thing to do for cardio and for balance. Now let's go to a kick. And I'm kicking across to get a little bit of a stretch in the hip joints. And I'll add a little arm swing, kicking across. And take nice deep breaths. So we want to increase the depth of our breath so you get oxygen into deeper parts of your lungs. If you breathe real shallow, some of your parts of your lungs are not even getting that oxygen. So nice deep breaths, blowing out and breathing in, kicking across. The kicking across also gets a little bit of rotation in your spine, and we want to keep all of our joints as mobile as possible. Your spine should have that ability to move in all different directions, forward, backward, side to side, and that rotation. Spines are pretty amazing structures, and we want to keep them that way. Keep that synovial fluid moving. That's the fluid that helps lubricate our joints. Kicking side to side. And now we're going to change to a heel tap. And anytime, if you want to increase your effort, because if you want to make the workout a little bit harder, then you're going to add an arm swing. And if you add an arm swing going over your head, let's see if I can get this coordination here. Then you'll notice it increases the effort even more. Anytime lifting over your head increases the effort. So if you feel like you're not working hard enough and you want to challenge yourself a little more, hands, arms over your head. And if you feel like it's a little too hard, or maybe you're not feeling as energetic today, then just don't reach over, don't reach quite as high. Now we're going to switch over to toe taps. Toe taps. That's activating your calf muscle. And we want all of our muscles and joints to stay young and healthy and alive as we get older. And it's that old saying, if you don't use it, you lose it. So we got to try to use as many muscles and joints as possible. I'm going to add an arm swing. Reaching and tapping. Reach and tap. Reach and tap. The thing about a cardio workout, because you're doing kind of a rhythmic motion, it's great to have some music. You want to make your physical activity fun, something that you want to do, not something that's a big chore, something you look forward to because you feel great, especially when you're doing it, but also when you're done. You know you did something really good for your body to help you live long and healthy life without any pain and with good energy. Cardio workouts help increase your energy because your body becomes more efficient at pumping that blood around. So even when you're not exercising, you just have to walk up a flight of stairs, something like that. It's not going to be so difficult. All right, let's do a side step, back to side, and you decide how big the step to make it. If you want to increase your effort, a little bigger step or a little faster pace. If it's a little much, then you slow it down and you take smaller steps. Pretty easy to adjust it to your own level. But you make it your workout. It's up to you. You decide. And if this isn't enough, if you feel like you're not, because you really want to get your heart rate going, you want to be breathing harder. We've talked in the past about something called a talk test. So you shouldn't, If you get at a good level, you shouldn't be able to have a whole conversation. It should be a little bit hard to get a whole sentence out. You'll have to talk in just short sentences. And then you're at a really good kind of moderate level of physical activity. Really gives you the best benefits. All right. We're going back to the kicks. So kicking across and add in the arm swing. Good work. Keep it going. Nice deep breath. Trying to get a little rotation for the spine. And loosening the shoulders. If you want more work over your head. It's really amazing to me what a difference it makes just going from here to here. I can feel it. I'm breathing harder anytime I'm lifting my arms over my head. So it doesn't take much. You don't have to sprint down the street to really work your heart and your lungs. Good work. And we'll go back to heel taps, but with a good arm swing. Big swings. So when we're doing the heel taps, you're lifting your toe, and that means you're working that muscle in the front of your shin. Really important muscle for a good stride when you're walking. If you don't pick up your toe, you can catch it on a little bump in the sidewalk. I did that years ago, ended up with a broken collarbone. So strengthen this muscle in the front to lift up your toe, have a nice stride when you walk, and prevent a trip and a fall. Big arm swings with a heel tap. Besides working the front, we're also stretching the back when you do that heel tap. So muscles are always in kind of these pairs, the antagonist and agonist muscles. One stretches while the other one contracts. All right, we're going back to side to side, side to side. Big steps or small steps, you decide. And I'm going to add a reach. Reach. Since a lot of cardio workout is very repetitive, you need that good music to move by and some changes in the movements to keep your mind engaged. Very important. Good work. Side to side with an arm reach. If you want extra work, do together. Double arm reach. Deep breathing. Good work. And we're going to change it up and do a lunge to the front. So step back, do a lunge, and up. Big step with a knee bend. Don't let the knee go over your toe. Just have it in line with your ankle. Step and lunge. Step and lunge. Keep that knee lined up with your foot. You don't want it to go in or out. That can put some stress on your knee. Step and lunge. One more. And other side, step and lunge. So we're working the quad here. We're stretching the back leg. Good job. Very nice. Couple more. Working balance too. One more. Good job. Going back to our march. And I'm marching faster than the beginning. Deep breathing. Good job. All right. Keep it going. Big arm swings. Now I'm going over my head, so we'll go up, down, up, down, up, down, up, down, and forward. Forward, forward, and forward. Let's go out. Out, 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 and up. Up, up, and up. Back to front. Forward, side, up, forward, side. Oops, up. I got my words mixed up. Up, forward, and side. All right, back to side to side. Side to side. Side to side. Good. Added the arm. Working the muscles, working the brain. Because you have to use the brain to move the body. Lots of messages being sent. Brain to muscles, brain to joints. Good work. Side to side. You decide the pace. If this is too much, slow it down. Side to side. And we're getting ready to go back to kicks. All right, so let's do side and kick. Side, kick, side, 2, 3, kick. A little different. Side, 2, 3, kick. Kick, kick, kick. Good work. We're more than halfway done. Good work. Keep it going. Side, 2, 3, kick. Let's try crossover. Side, cross, side, kick. Side, cross, side, kick. If this is too much, just do side stepping. Side, cross, side, kick. Cross in front. Side, cross in front. This is sometimes called the grapevine. We're just crossing one foot in the front. Side cross, side cross. And back to heel taps. Heel taps. Working that shin again. Stretching the calf in the back. Big arm swings. So you get a little bit of work in the bicep. Good job. You pick the pace. And reach up if you want. Reaching up. And reaching forward. 4, 5, 6, 7, and 8. Reaching up. 2, 3, 4, 5, 6, 7, and 8. Reaching forward. 2, 3, 4, 5, 6, 7, and 8. Reaching up. 3, 4, 5, 6, 7, and 8. Back to side step. Side step. Whew. Good job. Very nice. Keep changing it up. So let's do the reach. Reach and reach. Reach and reach. Reach. Nice deep breaths. Inhale, exhale, inhale, exhale, inhale, exhale. Good work. Strengthening heart and lungs, as well as joints and muscles. Working as many parts as possible. Reach and touch. And get ready to go back to the lunges. myself some room. Step and lunge. Step and lunge. This time we're going to reach. Step and reach. So we're working the core. Anytime you lean forward, you're kind of engaging the core and that quad. Reach and touch. Reach and touch. Step and reach. Step and reach. Step and reach. One more. Pull back. Other side. Step and lunge. Step and lunge. Keep it going. 4, 5, 6, 7, and 8. Let's just do 2 on the other side and 2 on the other side. Make sure this knee stays over your ankle. One more. Good job. All right, going back to the side step with the arms. Whew. Good job. We'll just do 10 more seconds, and then we'll do side step with a kick. So 3 steps and a kick. 1, 2, 3, kick. 1, 2, 3, kick. 1, 2, 3, kick. 1, 2, 3. Good job. Keep it going. 1, 2, 3, and kick. I think that's my favorite one for some reason. This is kind of a fun little dance. All right, now we're just going back to the kicks with a swing.